Hi, my name is Dr. Barbara Walsh. I'm one of the physician case managers at Advanced Medical. And I'm going to take a minute to tell you about some of my experiences here at Advanced Medical, and I'm going to share a really heart-wrenching case with you. One of the clients came to us and had a situation with her son. And unfortunately, he was a 26-year-old gentleman, very bright. In his final year of college, unfortunately developed severe OCD. There had been signs all along that he was struggling with some issues, but it wasn't until his final year of college that things became very obvious. He was unable to function, he was unable to leave the home, he was unable to care for himself in terms of basic hygiene. And mom and dad had tried a bunch of different things and were really unsuccessful. He had had a little bit of therapy here and there, some trials of medications. Unfortunately, it escalated to the point that he was really incapable of any sort of meaningful function in life. He was homeless, he had no job, he had no final education, and he actually couldn't even sort of interact or integrate with anybody, to the point he couldn't even accept the help from his family because he couldn't physically be around him because of some of the OCD issues. She came to Advanced Medical because she didn't know what else to do. She didn't know how to reach her son. She didn't know how to help him. She couldn't get him into the help that he needed for legal reasons where he was. And she came to us seeing if there was some way we could help advocate for him, if we could find out the next steps in his care and see what was available in terms of what their options were. So we went, did a history, got some of the notes. I worked with her and took the time to sort of listen to the details of the story. She sent me pictures, she sent me a narrative, she sent me a letter she wrote. So I really got a sense of who he was, who they were, and what the needs were of the entire family. And we went to a couple experts with the case summary once I had finished it. And we had two very renowned psychiatrists, one at the University of Massachusetts, the other at the University of Michigan. And we asked them to comment on the scenario. And they were fantastic. They were very detailed and very informative and basically said to this family, yes, there's no question, we think this is a severe form of OCD. And the goals of treatment aren't really to cure the illness because it's not curable, but to really minimize the symptoms so that he's more functional in society. And some of the things that came out of this were using the proper medications at the right dosages, which were not happening, and picking the medications that were truly appropriate for his situation. The other thing that came out of it that was really important to the family was talking about the proper kind of therapy, the intensity of therapy, and what his actual needs were. So he needed a form of psychotherapy, most likely cognitive behavioral or some kind of biofeedback. But he needed the combination of the two. The meds would only go so far, the therapy would only go so far. You really needed the whole. One of the final things that they talked about was a residential program actually at McLean's in Massachusetts, which is renowned for OCD treatment. And the parents were just overjoyed with the information. There were some more details within the report that are beyond the scope of this talk, but it really gave them some amazing options, some information that they were now armed with to say, hey, this is what we need to do to get you better. They talked to me several times after completing the report with me, and were incredibly grateful. They felt like this was the first step in saving their son's life. They felt that they were going to be able to share some of this information and really convince him to just try and take some baby steps into doing the right things to get better. And I have to tell you that they followed through and followed up with me saying that they were absolutely on the right track. If it hadn't been for Advanced Medical's report, they really feel that he would still be homeless and maybe even worse. So I would have to say this was an incredible success story, both for me personally as a physician, but also for the family.